I love dogs.
I love dogs too.
Glad we're all on the same page.
5, 4, 3, 2, 1.
Welcome to the Sarah Andreyko Show.
I get it. Awesome. So thank you so much for joining me. I want to have open the floor anyway for some big conversations. I guess the floor has already been open technically, but I think we need to talk more and more about some things that are going on in animal training and behavior. And I was at your session with Christina Spalding at the IABC conference, and I was like, oh, Dr. Pike is going to be somebody that I feel that I can trust, in terms of going back and forth with this dialogue, because the one thing that stuck out to me is during your session with Christina is that you two did not completely see eye to eye necessarily on everything that you were discussing.
No.
And I just thought you set the most amazing example in terms of opening the conversation, because you don't have to be on the same page. The idea is to tease everything out so that we can all come together and find a common solution.
Exactly.
So my thought for today was to tackle two things, and that might not happen. It might be ambitious, but we're going to give it a shot. The first being diagnosis in terms of behavior consultants and dog trainers that are treating behaviors that they are calling something. They are technically diagnosing by saying, I am treating anxiety, or I am treating fear, aggression, or whatever the case may be. Because in this industry, that is left to the veterinarians, the veterinary behaviorists, not anyone else that falls into the behavior or training category. I see a lot of issues with that. I see a lot of, it's very understandable, but awkward at the same time, coming from, a veterinary nursing background. And you can probably understand, with being in the medical industry, that treating something without a diagnosis is kind of peculiar, right? But at the same time, those professions are not authorized to. So that's the one thing that I wanted to get into a little bit today. And then the other one, if we get a chance to kind of start teasing out some things in regard to what regulation might look like in the dog training and behavior industry, whether that's something that we really should look more closely at, what the benefits are, what some of the repercussions might be to that, and if there's any alternatives that might help, be a bridge to that gap in terms of regulation. So, all right, diagnosing. Let's talk about that a little bit.
So Christina and I did disagree on this point in particular, mostly because she also comes from like the human perspective, the human world, where not only psychiatrists, which are, doctors, MDs, which is kind of like what veterinary behaviorists are. Well, not kind of, it's almost exactly like what veterinary behaviorists are. They can diagnose, but so can psychologists. And so psychologists do more like testing and that kind of thing. They can't prescribe medication, just like a behavior consultant can't prescribe medication, but they are going to diagnose and potentially put together a treatment plan. Whereas like I kind of look at it as diagnosis is like a medical term, right? Like we are veterinarians, we are, skilled and taught how to diagnose a medical issue, but the same is true for like behavior stuff. And I think the lack of being able to diagnose like from a behavior consultant perspective doesn't necessarily preclude your ability to treat, because you're treating a symptom, whatever the underlying cause is. While it matters, putting a term to it, I don't think matters in terms of kind of coming up with a treatment plan. So that's kind of my perspective on it.
So I'll tell you, the tricky part in kind of dancing around what it is that you feel that you're treating without having kind of something to label it. Say, we're working with someone whose dog most likely has separation anxiety, right? So we use terms like that. Chances are might have separation anxiety. That's up to a veterinarian to diagnose, but this is what we're treating. In terms of being really clear and straightforward with a pet parent or guardian, they don't understand. And so sometimes we have to explain that, but it seems very, dipping my toe in the water, like dancing around things, like not being straightforward with the client, because it's like, we're treating what's happening with your dog. We're treating the behavior of growling or panting or pacing or trembling. These are the things that we're actually treating, not necessarily the word that we're going to label your dog. But that's hard for clients. They want to know what's wrong with my dog. So I'm wondering too, if there's a bridge potentially between the veterinary community and the behavior community that can kind of come together and say, okay, can we do something to help the client understand what their dog is going through by labeling it if that's what they need, but
Yeah.
it's not the behavior professional that's doing the labeling.
Yeah, no, I mean, I think it is like that fine line, right? Of like, the owner client wants to know what is actually going on, what is the underlying problem. I always kind of harken back to Susan Friedman and her "don't label me" sort of directive of like, don't put a label on the patient. From a diagnosis perspective, obviously it's kind of a label. It's a label of the behavior, not necessarily a label of the patient globally. But I think there's ways that we can do more like descriptor terms. And so like even amongst veterinary behaviorists, we don't agree on diagnostic terminology. We do not have a
Yeah.
DSM. I wish we really did. Number one, I think we might even be forced into doing something like that if insurance gets the way that it does in human medicine, which it is kind of trending towards. But I think that you can have like a descriptive term, like a fear-based response, fear-based, aggressive response that isn't necessarily a diagnosis. And so, I think it's kind of that fine line, but honestly, I think until veterinary behaviorists come together and actually agree on terminology ourselves, I'm not sure we're going to be able to like really parse this out.
Well, I think would be a good resource too, would be, especially for people that are just starting out in this field, right? You've got people who want to be a behavior consultant or people who want to be an accredited dog trainer, and they don't know what terminology to use. They don't know not to say, your dog's fear aggressive, or your dog has separation anxiety or a separation related problem. What are those kind of lists what is a resource where especially newer people can go to say, okay, these are how I can describe this, instead of saying separation anxiety. I can pinpoint more the signs and symptoms that are occurring to help treat that situation and reduce those signs and symptoms.
Right. Yeah. I mean, and there are veterinary textbooks, obviously, that and depend on who writes it, is going to depend on what terminology they're using. So for like the, having sort of cohesive, message, I guess, using one particular textbook over another, might be a good starting point.
Yeah. Any thoughts on specific textbooks or resources that people can
Yeah,
go
I
to for
think
that?
the ones that typically people go to, there's the 5-minute veterinary clinical consult, which is a on canine and feline behavior. Debbie Horwitz is the second edition editor. I'm actually editing the third edition. Hopefully it'll be out next year. And then there's Karen Overall's book, and then the new edition rather, by Gary Landsberg and Lisa Radasta of canine and feline behavior is also a really good one.
Excellent. Now, let me flip this a little bit too. So from the primary care veterinary perspective, so this podcast is pretty much veterinary professionals and people in the behavior and training industry. And I run into this a lot as a behavior consultant. You've seen this, you've dealt with it. I haven't. I don't know what I'm doing. You just tell me what to do and I'll do what's needed, right? What are we dealing with? Is this conflict aggression? Do you want me to give them fluoxetine? It's like, no, I don't want you to do anything you don't feel qualified to do, because I'm not qualified to do that.
Right.
But that's tricky to navigate at times too, because the behavior professional, or even the trainer sometimes, if they specialize in a particular behavior, may have a lot more education and experience onboarded in terms of that than the vet. And the vet is leaning on that professional to say, I don't know how to help these people. What do I do? So often we have to defer out to a vet behaviorist, or at least do a vet-to-vet consult, so that vet has something onboarded that then the behavior professional or trainer can then take to the client and say, here's what we're going to do as a team. But I think that's hard sometimes for veterinarians, because number one, they don't want to deal with it. There's a lot of them that are like, I want nothing to do with this. So I feel like we need to think about how we can work through that as well, and provide more resources for veterinarians to say, yes, this professional has this knowledge, but how can I put what knowledge I have and what resources I have, so that we're working together as a team for this client, not just, here, tell me what you want to do, take this and just go do it.
Yeah. It is. I mean, it's hard for general practitioners, and I get it. We get little behavior in vet school. Thankfully, it's becoming more and more common, but it's oftentimes an elective course. So you have to actually want to spend a weekend or, an extra week somewhere in your busy schedule to do it. But taking medication, like recommendations off a behavior consultant, even one that has a lot of experience, is kind of like taking antibiotic recommendations for the ear infection from your groomer. Like a veterinarian would never trust what the groomer is, saying as far as that is concerned, and really shouldn't trust, someone who is not a veterinarian to actually do this, So I think that's where it really is important that the veterinarian kind of understands, like, what can and can't the behavior consultant do? What should they be listening to as far as that's concerned? And then also, like you said, reaching out to a veterinary behaviorist or a veterinary behavior resident that can help kind of talk them through what options are.
Yeah, I really like that more vet behaviorists are doing the vet to vet consults.
Mm-hmm.
I can say, like, just in my own practice, that has been a huge help to be able to
Good.
have the primary care vet and the vet behaviorist connect so that a plan can be put together. We've got the medication side covered, you've got the diagnosis side covered, and
Mm-hmm.
then, you've got the professional, be it a trainer helping or a behavior professional helping to execute said
Yeah.
plan.
Yeah.
So I think that's really helpful. And I hope to see more and more and more trainers and behavior consultants working with primary care vets and suggesting doing those vet to vet consults. They're less expensive in terms of consultations, for
Yeah.
the client. So it's cost effective. Can also help with that diagnosis piece too, that's
Mm-hmm.
often missing, even though it is good to work towards, not labeling as much, but I think that could
Yeah.
help, especially for
Yeah.
people struggling with that.
I agree.
Now, I will say, I think some of the vets are also conditioned to relying on trainers sometimes, dog trainers, because I have worked with, and I will, of course, not name any names because I give everyone a chance to grow and to listen in for open dialogue. But I've had a lot of open dialogue with other trainers that have either referred a case to me or I've gone back to say, hey, I know that you worked with this case. They listed it on your questionnaire. I'm working with these people now. Just want to see if there's any information that you can give me. What were they like working with as a client or their dog, or anything you think that I should know taking this case on, essentially. And time after time, I've heard people say, well, I just went ahead and gave him CBD the whole time he was here in my board and train, or I started him with fluoxetine because I had some in the back of the kennel. And I'm like, oh, so,
Wow.
and often that gets taken to the primary care vet when what's going on or what has been done in terms of
Mm-hmm.
training isn't working. So the
Right.
client goes and says, I use this trainer, and the trainer said, yeah, I tried this and I tried that. From a nutraceutical or psychopharmaceutical perspective.
Mm-hmm.
And the vets are like, oh, okay, well, that didn't work. Well,
Mm-hmm.
no, not necessarily. That probably shouldn't have been given. Well, should not have been given in the first place.
Yeah.
But
Yeah.
it happens frequently.
Oh, that's really sad. I
Mm-hmm.
haven't heard that from my perspective. I will say, like, around here, our trainers are, at least the ones obviously that refer to us, are really, really good about staying in their lane, and would never just give a dog medication like that, because number one, like, do you even know what the dose is? Right?
Oh,
Like,
Google,
there's,
right?
yeah,
I Googled
exactly.
it.
Yeah, exactly. Like, there's a dose range. There's, efficacy based on certain types of products. It just, it's a little bit of a wild, wild west out there if that's what's happening.
Well, and if you don't mind, just highlight some of the concerns about that, because for
Yeah.
me, unfortunately, I've run into it quite a bit, and I don't know that trainers that certain trainers are malicious or feel like they are stepping out of their lane. I don't think they
Hmm.
know any better. I mean,
That's
there's some
fair.
that I've talked to before that I'm like, oh, you think this is normal and that this is just what you do. There are trainers that just give things coming in the door so the dogs will have a better transition in. And I can tell just by interacting with them that they're genuine. They don't feel that
Hmm.
they're out of their lane or doing anything wrong. So if trainers are listening to this that are like, wait, that's the norm and that helps and this is good, can you just highlight some of the, especially from a physiological standpoint or medical
Yeah.
concern, what some of the issues might be with that?
Yeah, absolutely. Like, number one, side effects. There are certain medications and certain products that have certain side effects. And if you don't know what those are or the potential for those are, there are certain patients where fluoxetine is not appropriate. Fluoxetine, the number one side effect is suppression of appetite. And so if you have a picky eater, we're not going to reach for that drug. Um, interactions with other medications. Is that patient taking or using a heartworm, flea, or tick medication that could actually interact with some of our medications? Is that patient taking pain medication that can interact with and potentially cause gastric ulcers when used with an SSRI? Or even, like CBD. I think people think CBD is so like benign, and it's not.
Yes.
It does target receptors, and the reason it works is because it's actually doing things neurochemically. And so, like, do you know what that is, and what the side effect potential and interaction potential is? And that really is, where a veterinarian who has knowledge of these medications, or, obviously a veterinary behaviorist is most primed to be able to tell.
Yeah, certainly. And one thing you mentioned too with the CBD, like I just want to highlight too that this isn't just um, specific medications like fluoxetine or even
Mhm.
antibiotics. I've talked to boarding facilities that will also put dogs on antibiotics as
Oh,
well.
yeah.
But in addition to what most people consider a medication,
Hmm.
CBD, I'm glad you highlighted that because there are a lot of supplements on the market. There's a lot of
Hmm.
junk on the market. It's not
Hmm.
regulated by the FDA, but I also
Hmm.
see people recommending those. Now, I want to create a fine line or a distinct line here, rather. On some of my videos and things you might see, like I partner up with different supplement companies and I
Hmm.
use certain supplements. And, but often I always make the distinction like, talk to your vet before you do anything. Don't add this unless you
Absolutely.
talk to your vet. The articles that I write for partners, they might be supplement partners, but you're going to see in the articles, please
Hmm.
talk to your vet. Don't change anything you're doing
Yep.
nutritionally. Don't
Yep.
change anything you're doing supplementally, because even the most benign supplements can
Yeah.
alter that medical plan for that animal. One of the biggest things that stuck out to me was getting education even on omegas, right? So omega 3s and
Hmm.
omega 6s, and finding out that a lot of products are anti-inflammatory that contain pretty heavy doses of both
Hmm.
omega 3 and 6s, where omega 6s can be pro-inflammatory.
Hmm.
So if you've got an old senior dog and you're looking at picking a supplement for that dog, and you're like, oh, I'm just going to get this supplement that has lots of wonderful, sustainably sourced
Yep.
fish oil and it's packed with omega 3s and 6s, that could be a problem. That could make
Yep.
the situation worse, not better. So,
Yeah.
are
Yeah.
there a lot
Absolutely.
of common supplements that you see kind of being dealt out there in terms of helping with behavior issues that you're kind of cringing
Yeah.
at?
CBD. CBD is
Yeah.
like the number one. I think people think that it's going to like cure cancer and, do
Yeah.
everything. And really, like, it is very unregulated. Like, we actually have a researcher as a client. He does research for the FDA, and they did a human CBD testing trial last year, I believe, where they tested, I think it was like 70 or 80 different products, and only two actually had what they said that they had in them and nothing more or nothing less. So, like, some of these products are out there and you have no idea. There's contaminants. You're paying just for water. It's not even
Yeah.
actually CBD in there. The other thing that I see very commonly, and not from trainers, again, on more the positive side, I see this really commonly from like the punishment trainers, is changes to nutrition and telling
Mm.
them, oh, you need higher protein. And actually, like, that's like the worst thing for behavior is higher protein. It can actually have the opposite effect of what we want when it comes to anxiety. So, again, that's a medical thing. Veterinarians, this is a little bit of a soapbox issue because people think vets don't know anything about nutrition. Veterinarians know a lot about nutrition. It is in every single course that we take. Be it from biochemistry as our, part of our undergrad requirements, all the way up to an internal medicine course where we're talking about nutritional impacts on disease processes. So really need to talk to your vet about nutritional changes as well.
Yeah. And I think a lot of people are concerned or jaded because, they feel that vets just recommend the products that are on their shelves. And
Mhm.
so, whereas, a lot is coming out about different limited ingredients and avoiding certain additives and things like
Mhm.
that, some of those bags contain some of those additives that people are starting to tease out, and that we're starting to see some research to show, different levels being harmful, or, less desirable and that sort of thing. So, with this trend of people moving into that limited ingredient type diet, because there's always these fads, grain-free and raw and everything
Mm-hmm.
else. But
Mm-hmm.
I do notice that a lot more trainers are getting involved with nutrition too, without a nutritional background or without
Yeah.
a board certified veterinary nutritionist actually
Mm-hmm.
reviewing any type of recommendations or seeing that client or anything like that. And I find that really
Yeah.
scary too.
Yeah.
Especially with all the studies coming out about how the gut plays such a huge role in behavior, and
Huge.
health and that
Huge.
connection.
Mm-hmm.
And we don't really know what to do with all of the information we've found just yet because it's
Yeah.
still in progress. So to say, you need to do this with your diet, do this differently, or you need to change that, that could really alter things in the opposite direction of the
Yeah.
intention.
Yeah.
Um,
Absolutely.
I mean, I feel like we're still struggling to bring people along to this idea that dogs actually have domesticated dogs rather have more of this omnivorous diet than
Mm-hmm.
a strict carnivore diet.
Yep.
It's kind of like the human fad. Carbs are bad. Fat is bad.
Right. Right. Exactly.
Everything
Exactly.
cycles. But yeah,
Yeah.
just to highlight, like I think you could probably agree to this, have way more knowledge and education and experience in nutrition than they do even behavior.
Exactly.
Where behavior, you get that little dose, but nutrition, you get
Yeah.
much more. So it
Yeah.
takes some give and take on both sides of the equation, I feel like, to where your
Mm-hmm.
primary care vets need to be open and interested for those clients interested in nutrition and looking at diets that are outside of the vet hospital. So the fresh food
Mm-hmm. Mm-hmm.
diets that are out there. And I've noticed too, some vet behaviorists are putting some good information out there about how to help steer people from a veterinary
Mm-hmm.
perspective to different diets without those, consultations, if money is a
Mm-hmm.
concern,
Mm-hmm.
saying kind of stick with these. These are, formulated by a board certified vet nutritionist, whereas
Mm-hmm.
this one hasn't really been third party tested. And this one
Yeah.
might source ingredients from overseas. And maybe we want to avoid that. Might be
Yeah.
okay, might be fine, but
Yeah.
just some of those general guidelines. And on the flip side of that, so we got the vets kind of bleeding into there are other nutritional options, not in my hospital,
True.
but
Yeah.
from the client side, how do you think that, what is the easiest way to build more trust with those clients in terms of what your primary care vet actually really does know?
Yeah. I mean, I think it's really tough because I will say, if you are a consumer, I can't even imagine walking into a pet store and being like overwhelmed by the amount of
Especially a brand new
diets.
pet parent.
Yeah.
If you've
Yeah.
never done it before
Totally.
and you're like,
I would be like, I don't even know where to start in the pet food aisle. But
oh, and here's the scary part. Who's the person you're going to ask?
oh yeah, the pet store worker that's like
The
16,
pet store worker.
right?
Yep.
Yeah. Yeah, exactly.
I used to have that job when I was 17 years old. That's right.
Yeah, exactly.
18.
Yep. Gotta love that.
You should get this food because the representative told me.
I know. Exactly. They were here the other day and they gave us treat pouches or whatever.
We had ice cream.
Yeah. So, I mean, again, like you said, like there's the ones that we carry on our shelves. I always say, like, yes, there's a reason why I carry those on my shelves, because they are tested. They have board certified veterinary nutritionists on their, their rosters who are developing these diets and making sure everything is nutritionally complete. And, they do outside testing. They do, the reason that there are recalls in certain products is because they're actually testing it. I always hate that when people are like, but that has recalls. Well, yeah, if you're testing your product, not everything's going to be 100%. Like, wouldn't you prefer they're actually testing it versus good luck? So, again, I'm not going to carry something that I don't believe in and that doesn't have science behind it. And so there's a reason why those certain products are on my shelf, versus others. But again, there are others that may be nutritionally complete, nutritionally appropriate that we don't carry. Space obviously is a big issue.
Okay.
And again, just the numbers,
Overhead.
but overhead. Yeah, but there are board certified veterinary nutritionists that clients can consult directly with. University of Tennessee has a program where clients can get a nutrition consult, and that is remote. There are board certified veterinary nutritionists in our area that do remote consults as well. So if you're interested in something like that, go to the expert.
Yeah, I've done personal consultations with Dr. Laura Gaylord, and she's fantastic. She is, she takes everything that you throw at her. Like, I've researched all these different diets because, of course, I have, right, before coming to her.
Yeah.
Like, I want to make sure I've got everything down and I have all these examples. And she really took the time to go through them and say, okay, here's what I like about this. Here's what I don't like about this. So if you're going to pick something, like, here are my guidelines. Here's why. So explaining. So it's not just pick this kind of thing.
Right.
But also, here's some alternatives that you that aren't on your list that maybe you want to consider. And here's why I would make that recommendation.
Yeah.
But it makes looking at what you're putting in your dog's bowl a whole lot easier because you're just going straight to the expert. And there is cost involved. But in the long run, if you think about the life of your dog and adding to the life of your dog, it makes a lot of sense.
Absolutely. Yep.
We got way off topic.
Oh, yeah, we did. That's all right. I have soapboxes. I like to talk.
love them. I love them. I think it's so helpful because it really is. I think this is an area where a lot of people struggle. Even things like, probiotics. I have a dog stay with me that I think either is on antibiotics and, I think it would be good. The first thing I do is pick up the phone and call their vet. Is it okay if, and here's what it is? Because even with that, looking at Jessica, was it Jessica Heckman that did it? Yeah, I think it was Jessica Heckman that recently did a seminar. She did a meta-analysis of a bunch of research that was coming out with probiotics. And she was finding ones that are particularly harmful, essentially, if you're working with anxiety patients. So they were finding that Lactobacillus casei in particular, and some of the general probiotics was showing a spike in anxiety-related behaviors. So just even stuff like that. So I think I love the soapbox.
It's not benign. It's not benign at all.
It's meant to do things. That it does do things. So okay. So the last thing I want to say about this, because then I think we could move on to regulation. I think it would be great to get that in. Is just from your perspective. Again, we're just teasing out some solutions. I like to be able to be direct and clear with my clients, but I also have the luxury of working with a lot of primary care vets and vet behaviorists. Like I've developed relationships and I feel really good about that. So I can pitch that off and we can work as a team and we've got the thing down. But I feel like a lot of behavior consultants, but more so even dog trainers, don't necessarily have that team down just yet. And not even realizing that everybody wants to work together as a team. I feel like there's always like, do I work with the vet? Do I work with the trainer? Do I work with the behavior consultant? Yes, we all work together. So when it comes to helping a client best understand what's going on with their pet, what are your recommendations as a VB to kind of bridge that gap to where the client feels they know what's going on with their animal? They are able to get a diagnosis, whether that's through a VB or a vet. Do you feel comfortable with vets giving that diagnosis as well? Primary care vets?
Yeah, I think there are certain ones that have that comfort level and have gone to, they're qualified. They've gone to continuing education, So
yeah, and then kind of giving that and looking over the behavior treatment plan and saying, yes, I'm on board with this, or having the VB if they're not, they don't want to deal with that kind of thing, saying, yes, I'm on board with this, and then rolling out with that plan. But my question is in terms of making sure that the primary care vet is appropriately compensated for that work, but also making that still cost efficient for the client and the behavior consultant or the trainer if they are absorbing that cost to bring the vet on board to help with that.
Yeah. I mean, I think just like in the human world, it is a team effort, right? It takes the psychiatrist to diagnose and prescribe medications, but many family doctors feel very comfortable, at least maybe like first line of defense medications, diagnosing, all that kind of stuff. So again, your general practitioner, depending on their comfort level, and the social worker therapy, that's like the behavior consultants, right? Like they're going to come in and do the treatment, and behavior modification. So, but again, like you said, I mean, everybody needs to be kind of compensated for their time. And even for vet to vet consults, the veterinary behaviorist is going to charge the veterinarian, and the veterinarian is going to need to then pass that cost on to the client. But again, like you said, it's more cost effective that way than seeing the VB directly oftentimes. And so, there's going to be a cost associated with it, but you are going to have the most success by having a team approach to the treatment for sure.
Yeah, I could not agree more. And even there's been a few cases where I'm working with a vet behaviorist, a neurologist, a veterinarian, and a dog trainer all at the same time, all within the same team. And I want more people, especially listening, to understand that that's a real thing. And that is like the A team. And it makes a huge difference, especially for families that are really struggling with deep rooted behavioral issues. Like it helps a lot to have that whole, perspective on what's going on. So let me ask you this, and this will segue into regulations. What if, in terms of credentialing, in terms of this magical board that doesn't exist overseeing regulations in the industry, What if there is an educational level in terms of from the vet behaviorists or even the professors that obviously instruct and teach and are overseeing vet behaviorists as they're moving through their internships? And anyway, those people who are much smarter than the rest of us out there. What about something in terms of regulation overseeing the ability or the credentialing or the testing ability to sign off on saying, yes, this person has reached a level of medical understanding of physiology and is capable of making a diagnosis. They are not capable of prescribing medication. They are not a medical doctor, but they have enough knowledge, and we have tested that knowledge very thoroughly to say, yes, this person knows what the signs and symptoms are of a separation related problem versus separation anxiety versus fear, aggression, conflict, aggression, stranger danger, and all that thing. Now, I know part of that lies on the definitions, making sure that there are actually agreed upon definitions by those that are at the top tier of that level. So yes, please, vet behaviorists, get together. Let's do this.
I know.
I love definitions. I like the lines and the parameters. But what are your thoughts on that at some point down the road, having the ability for other people in the profession with X number of hours, X number of, say even like something like an internship or a residency under a VB where they're, able to take their education and their abilities to the next level, so to speak?
Yeah. I mean, I think that is definitely something that should be happening, and it kind of is to a certain degree. Like for veterinary technicians, we have the veterinary technician specialty of behavior. So like they undergo additional training in addition to their technician degree.
We need more of them.
Oh my gosh, yes.
There are not enough
for sure.
anymore.
There are not enough for sure. And then like certified behavior consultants, so like CBCC, KAs, that I think that is kind of like the higher, potentially like the higher level for, a trainer as well, or like IABCs, their certified dog behavior. Yeah, exactly. So I think that definitely is the trend. And I think that's actually where things should go to. I think the hard part is the regulatory body that oversees all that. And
making sure things don't slip through the cracks.
Exactly. So, and, it is interesting because veterinary medicine is very regulated. We have a state board, we have a national board, we have our specialty colleges, and there's actually a board that oversees all of the specialty colleges. So like, it's very, very regulated. I couldn't call myself a veterinary behaviorist until I had passed that exam, even when I was just practicing behavior only as a resident. So, we can't call ourselves that, but I think, as you know, behaviorist is a term that gets thrown about willy-nilly by anybody.
Well, but especially with country to country difference too.
Yeah, true. Very true. So yeah. So we have to tighten it down as far as I'm concerned.
Yeah, I agree with that. And I to your point about the vet techs with specialty behind them, especially behavior specialty, like originally that was my thought. Well, if you want to be able to at some point label things, diagnose things, then that's the route to go, right? But then I'm probably a good example in terms of where I am in my career. So I started off in veterinary nursing before it was all dissected into different labels. It was in 20-something years, all different fields, and never actually went to tech school because I was on a path to go to vet school. I thought I wanted to be a surgeon or maybe a veterinary forensics or get into veterinary forensics. And then I realized that nonprofit and behavior was my passion. So pulled the plug on that, especially working all those long ER hours and everything.
Yeah.
But anyway, all that to say is, I think there are a lot of people in this career that are my age, that I'm 44, by the way, that have been doing it for a long time, that have a lot of experience. And while the vet tech specialty in behavior to me says, oh, this is what I want to do, this is where I go, it's a lot of expense to incur in terms of going back to school and getting that and time. And it's time you're not working. It's time you aren't making an income. A lot of people in our profession are self-employed, so taking that time away and adding to your student debt if you've already paid off, for me, I've been out of school for a long time, but so that's hard. And so I feel like if we had an alternative or even some sort of way that it's a lot less expensive, for somebody in my position or any behavior consultant or even a dog trainer to go through that so they have a better understanding, that would be great. I just feel like that doesn't exist, that path that coursework
No,
doesn't
I agree.
exist.
Yeah, I agree. I mean, and that's kind of and I think I brought this up in our talk, my talk with Christina, is that, what about people that are disadvantaged
Hmm.
income wise, or, by the color of their skin or whatever? Is
Yeah.
like, we need some sort of system to make this easier for people to do. Because I do think there's a lot of people, like you said, that would do it
Hmm.
if they had the ability to do it. And, this is a whole other issue, but like, I'm a huge proponent of making higher education free. So, because let's be honest, even as veterinarians, we come out with so much debt that many of
Yeah.
my colleagues will never actually pay off their student loans for their entire lifetime.
Yeah, that's
So,
scary.
it's ridiculously expensive to become a vet, but obviously a lot of us are very passionate about, being a veterinarian and want to do this, but there's that big hurdle. It's huge. So there's no perfect answer, unfortunately. I wish I, could magic wand it and just make it so, but
I've been told
I
you have
think
magic wands. Come on, Elizabeth.
I know, I know. I always tell my clients, I'm like, oh, my magic wand is at the shop today. I'm sorry. Sorry. It came on the wrong day.
It was a little glitchy earlier, so I had to
Yeah,
send it off
yeah.
for some maintenance.
Yep. So there's, again, no good answer, but I do think we need to lean towards regulation and education and just how we go about that. Not sure.
Well, there's been some kind of model legislation proposed, and there's been
Mhm.
some legislation actually proposed, like in New York, which was really minimal. Illinois is
Mhm.
currently, it's been bounced around in Illinois, um, and it's not being well received. I think there's a long way to go before we kind of
Mhm.
have a clear picture of what regulation moving forward looks like. But from your perspective, what do you see regulation in the behavior and training industry looking like? Like, what would you think would be kind of ideal?
Yeah, I mean, number one, a license, period. You have to have a license to cut hair, for the love of God, but you don't have to have a license to
A
actually
good
train a
point.
dog. So yeah, number one is a license, and that would be the minimum standard. And then I am a huge proponent of, I think we need to ban certain tools and techniques, unfortunately, because I don't think that we're ever going to make inroads in the industry to shift to positive reinforcement based force free training without actual regulation there too, because people see quick, easy, quote unquote fixes. And obviously we know why the shock collar and the prong collar work, right? But owners who don't understand learning theory, they don't understand body language, don't understand the repercussions of those types of things, and they get duped by trainers that, again, not licensed,
Smoke and
not
mirrors. Hmm.
educated. Yep.
Yeah.
So I think those are kind of like the two starting points, honestly.
So I definitely agree with you on technique, but I kind of, and this is going to, some people are going to be quite shocked by this probably, but I will elaborate. I disagree on banning the tools.
That's fair.
And yeah, and there is a reason, not because I use them, not because I am a proponent of them at all,
Yeah.
but I see this more as an education issue and a
Hmm.
technique and methodology issue because I feel that people who are naturally more inclined to be extremely rough with dogs or violent with
Hmm.
dogs or abusive with
Hmm.
dogs to get their way are still going to be that way. It's just going to
It's
be
true.
harder. And then also, it very much because I worked with pit bull type dogs for the longest time. My nonprofit organization is all centered around pit bull type dogs and stereotypes and the overpopulation and neglect and abuse. But it reminds me very very much of breed specific legislation because
Hmm.
we're slapping a band-aid. We think we're taking this out of the equation when really we're making the problem worse
Yeah.
because by removing the law abiding citizens, what's left? The people who don't care about the law, the people who are going to do what they're going to do anyway. They're just going to do it underground. And that concerns me. So,
Yeah, I think they're good points, very good points. I think the hard part is that until those tools aren't readily available for average Joe citizen to walk into PetSmart and grab a shock
yeah,
collar off the wall, we're still education is awesome. I agree. I would love to like shout it from the rooftops about why we want to do certain techniques and not use tools and obviously not abuse dogs in the process, but I don't think that we're going to get really good inroads with general public until those tools are just not available to them.
Yeah, I could agree there. What do you think about kind of an intermediary step to where, because some of them are like Petco is pulling anything that
Hmm.
they consider aversive off the shelves.
Yeah.
So we're getting there, but what do you think about regulation being more towards that, to where it's not available to the general person that walks into a store? It's not available to anybody that isn't a professional, so to speak. That way it's starting to kind of filter it out, and rather than making that leap to they're all gone, it's making that it's a step in the direction of there are different ways to do things, there are better ways to do things. And if the average person that walks into the store with a dog that just won't stop barking in the backyard, and they're like, I need a
Hmm.
shock collar, or I need a bark collar, or whatever, is if they
Hmm.
don't have access to that, they have to start thinking about doing something differently. So that's the one area that I definitely agree on, is that being
Yeah.
less available is going to help reduce that, filter it out. Because if you're like, I don't have the tool, now what do I do? Okay, now you have to seek
Yeah.
professional help.
Yeah. But I think the other side of that coin is the professional help that you might seek is bark busters, or oh, probably shouldn't name trainers on here.
Whoops.
Can
I
we
don't
cut that
know.
out? No, just kidding. But a lot of my clients go to these, big box franchises that are all punitive, and while they're not coming in with the shot collar is placed on the dog when they're
Yeah.
there, and
Yeah.
so again, the trainer is doing it, and so owners are like, well, you're the professional, I'm going to trust you. Your
Yeah.
reviews on Yelp looked amazing, right? So I think, again, it's hard. It's really hard. There's only so much education that I can do in a day,
Yeah.
and that all of us try and do. And I think we have done a very good job thus far with the people that we've reached, but we're not reaching everybody.
It's
So
slow going. It's really
yeah,
slow going. It's not fast enough to keep up with
yeah,
a lot of the damage that is being done out there. But I think
exactly.
I think a lot of that could change with regulating the training industry.
Hmm.
With saying these are the current methods that we use to work through these different behaviors,
Hmm.
these different training skills. These are all the things that you can do. This is all of the education that you get before you sit for a test to be
Hmm.
credentialed, whether it's through
Hmm.
CCPDT or IABC or wherever you want to go. But that's why I like so much the joint standards of practice
Hmm.
between IABC and ADI, and
Hmm.
which is the largest service dog recognized organization in the world, and
Yep.
CCPDT and APDT. Like, these groups are coming together to say, we're on top of it. We're on top of the
Yeah.
behavior industry. We keep up with the research. We're on top of the training industry. We put the education out there that's
Hmm.
behind this. We credential these people. So I like that there is a joint standards of practice. There is something coming together in terms of a body to say, if you're going to be the professional that the person walked into the store and couldn't get the bark collar or couldn't get the item, you're going to
Hmm.
be the professional that they go to, because now it's regulated and you have to have a certain level of education and experience to be able to get that accreditation or
Hmm.
that license, so to
Hmm.
speak.
Yeah, and an ethics code too, right? Like
Yes.
that's the other thing. It's like because there's a local trainer here that claims to be Lima, and she is Lima, and the fact that like she starts at the top, but she quickly goes to
Mm,
punitive methods, and when the others fail, and it's like, well, the reason that they're failing is number one, the skill level of the trainer,
hmm
but also like a lot of these patients have severe anxiety that's precluding their learning ability. And so, that's the lack of recognition of that, and, sending them for appropriate treatment for that is kind of where this person is forced into, quote unquote, using these tools and techniques. But again, claims to be, positive and unless otherwise needed. So,
Well, I think it's such a subjective acronym anymore, because also, I
hmm.
don't know if you saw, but recently, what's his name? Like Stephen Lindsay or something, that came up with Lima, has
Hmm.
been kind of speaking out that we've been using it wrong. We have the wrong idea about it, and this is what it really means. And I think a lot of people that are not necessarily accredited or are a little more heavy-handed than some. I'm not talking about your average balance trainer or your average behavior consultant or accredited trainer, but I think that's now being used differently in terms of a definition, since he came
Hmm.
out and said, this is how I use it. And
Yeah.
it's funny, like someone said to me, like, where has he been? Like, it's been 20 years and he just crawled out of the woodworks or whatever, almost 20 years. And now all of a sudden he
That's funny.
resurfaces like a roly-poly under a rock. Like,
Oh, that's awesome.
so, yeah, it's hard because a lot of people feel that's very subjective because
Yeah.
they don't have they say, okay, these are the tools in my toolbox. This is what I know to do for
Mm-hmm.
XYZ. And when the dog doesn't respond to XYZ, now I'm like, my tools are limited.
Mm-hmm.
That is the magic moment to where they need to drop the ego and go, this is out of my league. Like
Yep.
I need help with
Yep.
this. I need either a behavior professional or a vet behaviorist, or even just to loop the vet
Absolutely.
in and have them on board. And I think that's the line that a lot of trainers are struggling with. Like, you don't
Totally.
have to do it all, and there's no growth in ego. Like, there are other options out there, whether you know
Yep.
it or not, there are.
Yep. I mean, even veterinary behaviorists, we have a listserv, we're constantly emailing one another like, hey, I have this case. Does anybody have any thoughts? Right? Like, I've only been a vet behaviorist now for 8 years, which is so weird to say that it's been that long. Feels like yesterday, but like, there are veterinary behaviorists that have been boarded for 30, like, they have more experience than me. And so I'm going to go to them if I have a case, like you said, drop the ego and ask other people for help. Like, that is, to me, I think, the best choice you can ever make for your patients and your clients.
I
So,
totally agree. But also, for the people that don't know, there are alternatives. You don't have to do it all. Like, it's
right.
not
Yeah,
completely up to you to solve that problem if you feel uncomfortable solving it, or what
totally.
you're doing isn't working. I love the fact that I've had trainers reach out to me that I don't know. Hey, I saw
Hmm.
a YouTube video of yours, or I saw you on this Facebook forum, which I don't want to be on, but I'm on because it's for the good of all things animal related. But reach out and say, hey, I didn't want to say anything publicly because there's backlash, but
Hmm.
you said that you would handle this differently. Would you mind walking me through that? And I'm like,
Yeah.
absolutely, 100%.
Yep.
Let me give you my protocol for that.
Yep. Yep.
And be
Exactly.
flexible. If it doesn't work, please come back to me. Or if it needs to be adapted, because you're working with an individual in front of you,
Hmm.
there's no one size fits all. So I can tell you what I do, but you got to feed off of what the animal in front of you
Yep.
is giving you back.
Yep.
So not feeling like they're alone anyway.
Yeah,
You see
totally.
downsides to regulation? Like, what are some downsides that you see to?
Yeah, I mean, I think the biggest is, the people that have been in the industry and that actually are good trainers, but they don't have the educational background, like the intense educational background. They don't have the letters behind their name, and they're at a place in their life where they can't afford it. They don't want to go to, anything else. Like, we're going to lose those people. And I think
Yeah.
there are value to those people that have been doing it for a long time and actually know what the heck they're doing. So again, I don't know what the answer is.
It's the same as the vet tech with specialty. Yeah,
Hmm.
it's the same
Yeah,
same situation. But I wonder if
totally.
there's any sort of subsidization or grants or anything like that that we could,
Yeah.
brainstorm. I say we, like, as a collective unit of people looking
You
for
and I, we're
change.
going to solve it.
We got it, Amy. We got it. We're gonna do this. I'll have it on your desk by tomorrow morning for
All right,
approval.
perfect. Perfect.
But I mean,
Yep.
something to
Yeah.
encourage people to do that, because you're right. People who've been doing it for 40 years, they have the knowledge to pass it. If they've been
Hmm.
keeping up with their continuing education,
Yeah.
whether they're licensed or
Yeah.
not.
Exactly.
Even when I was working and I was not registered as a technician, I still did continuing education
Hmm.
every year. All the time. I
Yep.
went to all the conferences. I did
Yep.
extras on the side. Like, there are lots of trainers out there, lots of behavior
Yeah.
professionals that are out there doing the same thing, that have done the continuing education and would be able to qualify for that. But
Yeah.
you're right, having the access to that can make
Yep.
things really difficult. It's not worth the expense. So I
Yeah.
wonder what kind of help would be out there. I mean, even the IABC, for example, now that
Hmm.
it's split into two divisions, we've got the
Hmm.
501c6 and then our sister organization, the 501c3. I could
Hmm.
see that being something that IABC
Totally.
in particular, providing grants to people who,
Absolutely.
after regulation, need help getting that credentialing
Yep.
because they have less access, or they're still paying off student loans,
Yeah, exactly. I
things
think
like that.
that's exactly what we have to do. And again, like the disadvantaged populations, we have scholarships or
Yeah,
grants, whatever the case may be.
but there's
I
hope for
think,
it. We can make it work.
yeah, let's do it. All right. I'll expect that tomorrow morning.
You got it. 9:30. Okay. I'm a little busy.
Yeah. Sounds good. Sounds good.
Oh, well, any other thoughts on the regulation? I mean, do you think this is something that we'll see in the next
In our
five
lifetime.
years? Yeah.
Yeah. I think we will. I really think we will. Again, like the joint standard of practice, there is, like you said, legislation happening in, kind of a state by state basis. I think PPG is doing a really good job kind of spearheading a lot of that drive. So I think we'll see it. I hope we'll see it.
I hope so too. The IABC is currently working on a white paper.
Oh, nice.
The legislation committee has been researching, collecting data, and putting information together over the past year and compiling all of that. And hopefully before the end of the year, that's the goal, that white paper will be released, will be published in terms of all of that information, all of the data collected, and what a recommendation, a starting recommendation would be for regulation in the industry. Obviously, it's just opening the door to that conversation, but I think it's a great start in terms of helping people that are on both sides of the fence see what has been done in other countries, what's successful, what's not successful, what it entails, what it looks like. I think that it is probably less restrictive than some of the behavior professionals or force-free trainers might like, but I think it is considerably less restrictive than a lot of the trainers on the opposite end of the spectrum would think it would be. I think a lot of the fear with some trainers is you're going to tell me to do too much, or you're going to regulate everything that I do and everything that I am doing, and I'm going to lose my income. And so I think it's a nice happy medium, at least to start, based on the data that was collected. And the recommendations are specifically based on the information, not on my opinion or the committee's personal opinions or any of that. So I'm really looking forward to the response, when that comes out. Hopefully people read through it thoroughly, so there's no assumptions, and maybe it can get us at least started, in the right direction. So, okay, so I love learning from you. I want to wrap up with tell other people how they can learn from you. What are you involved in the coming months? Probably not the holidays, but continuing education. What Behavior Wellness Clinic is offering. And what you're going to be up to in 2024 that people can listen in and learn from, because like I said, I absolutely love attending your sessions and learning from you as well.
Thank you. So ironically enough, I'm trying to slow down a little bit on that type of thing, only because of the 5-minute book that I'm editing. It's going to basically take up the next year of my life. But my business partner, Amy Learn, who's also a board certified veterinary behaviorist, I love her. She and I have our own podcast now called The Behavior Buzz. So you can listen to us on there, and we've got lots of fun guests. And so that's kind of our big focus for the next year. I'm going to be at the DVM Moms group every year. So a group of veterinarians who are also moms. I think there's like 20,000 in this social Facebook group. But they host a conference every year, and I'm going to be doing some behavior lectures there. And then I'm going to be in Providence, Rhode Island for International Veterinary Seminars next September. So
excellent.
Got
some things on the books.
Some things on the books. Yeah.
Awesome. So I'll put a link to the podcast in here as well as to your website, so people can keep up with that. So
excellent.
Fantastic. All right. Well, this was fun. I'm glad we got to dive into it a little bit, and I hope people hear this and they want to be more a part of the conversation as well.
Love it. Thanks for having me, Sarah.
Take care.